Okay, first of all, very good morning to you.
Good morning. Thank you.
Before we start with anything, I would like to know your name as well as where are you practicing at and it's been how many years you're doing this?
I'm Dr. Qutubuddin Ali from Bhopal. I'm working as a senior consultant urologist and renal transplant surgeon at Apollo Sage Hospital, Bhopal. And I've done my MCH from PGI Chandigarh, and in small, almost 16 years I've been practicing for the urology.
Okay, so we're gonna be having topic for BPH and let's start with the first question. So why, according to you, are the cases of BPH are on rise?
Actually, it's not like a BP cases of BPH are on rise. It's a normal physiological process. The gland, the male that has that gland, it grows with the age. And with growing gland, in some people it gives symptoms, and some prostate glands which are enlarged may not give you the problem. So it's the awareness about your well-being, and leads to the increase in the detection of the urinary problems because of the BPH. And because, as I said, as the gland increases with the age, and person pursues that problem that he's developing over the course of time, is the part of aging. He neglects it. So problem is there, but depends on what is the perception of that problem.
What lifestyle modification would you recommend for a BPH patient to lead a comfortable life?
Yeah, because the symptoms of the BPH develops usually after the 50 or 60 years of the age group, and these are the very subset of the people also have the significant number of people have the diabetes, hypertension. First and foremost thing is the physical activity. They should have the physical activity at least 10 to 15 minutes physical running, any form of the activity they should have. And to manage their symptoms, most of the patient initially develop symptoms during the night. They have to go for the voiding during the night. They have to get up from the sleep. What we advise them to have the limit their fluid intake, like anything like water, coffee, juice, at least 2 hours before they go to the bed, so that the urine output is decreased, so they don't have to get up from the sleep and the sleep is not disturbed. And second thing is, you have your fluid intake should be like this, so that you should not have the fluid at one go. As and when you feel thirsty, as and when you like to have the fluid, take some little amount of the fluid, and whenever you feel like voiding, at the first sensation they should go and relieve themselves.
Heading towards the next one, when does surgical intervention become necessary? Can it be avoided?
Of course, there are the symptom gradings of the prostate, as we do the mild, moderate, or the severe symptoms. And most important thing is how bothersome the symptoms are. If the symptoms are mild, if they are not bothering their uterine lives, we can go for the watchful waiting, or for the medical management. There are certain indications for the surgical indications, what we call as the absolute indication, like when the medical management fails, patient develops the renal deterioration of the renal function, develops the hematuria, blood in the urine, recurrent episodes of catheterization, then definitely we could go for the surgery.
Okay. Lastly, any message for all the upcoming urologists?
Uh, be honest to yourself and be honest to your patient. That.
Okay, thank you very much. That's all. It was nice talking to you. Have a great time ahead.